Dr. Deborah Serani, welcome to Shrink Wrap Radio.
I'm so happy to be here today. Thanks for inviting me.
Well, I'm really glad to have you here because you have a very important story. And we're going to be discussing your book, Living with Depression, Why Biology and Biography Matter Along the Path to Hope and Healing. And so I think this is going to be very meaningful to people who struggle with depression at one point or another in their lives. And the book is rooted in your own personal experiences as someone has suffered from depression over the course of your life, and also as a psychotherapist whose work has been informed by your own experiences with depression.
That's true. Very true.
Yeah. So we'll skip around a little bit. One of the things I'm initially wondering about is, were there environmental family predictors? If somebody had known your family history, would they have found evidence for, there's going to be issues here, maybe?
Yes, indeed. And such a good question, because as clinicians, we look for that early narrative to help inform us.
Right.
But at the time, there were quite a few mood disorders in the family. Nobody really talked about it. So there's a definite genetic lineage there. There were also difficulties in the family system, certain marital issues that were going on at the time. I was one of 3 girls, and I was the never do bad, always do good, be quiet kind of girl, which certainly muted a lot of the persistent depressive disorder or dysthymia that was certainly going on at that time. So yeah, I was not a great student, but I pulled my weight. I struggled terribly with a lot of things. Somebody really paying attention would have seen I joined every school team and dropped out of every school team. I joined every activity and then dropped out of all of those things. There were totally signs there, but at the time, nobody, I wasn't a squeaky wheel, so it was easy for me to be missed.
And were there, you mentioned genetics. Do you know anything about the genetic predisposition in the family?
Well, I knew that both my paternal grandparents struggled with depression. It was never spoken about, but they were sad. They were sad, slow, lived in the dark, not a lot of fresh light and activity and spark in their house. I came to see that my dad was struggling with a cyclothymia. I was able to see that as a professional, and other bipolar pieces and unipolar pieces in my maternal side. So both sides of the family, a tremendous amount of mood disorder, which was easy for me to see in the rearview mirror. But
Sure.
I grew up at a time that nobody really spoke about any of those things, and nobody went to therapy for any of those things.
Right. What were the economic circumstances of your family?
We were upper middle class, I'd say, in a suburb of Long Island, which was a very nice community where we lived. My dad was a very, very bright man. He was a firefighter for the FDNY.
Oh, wow.
And on his time off, he trained to become a chiropractor. And because firefighters would work 3 days and be off 4 days. So many firefighters at the time had second careers. And he was one of the first licensed chiropractors in the state of New York. So, and my mom raised us until I was about 12, and then she went back to work. my parents were older when they had us. They waited about 10 to 12 years after marriage to have us because my dad was
Uh-huh.
going through chiropractic school. So we never really wanted for anything. We never really, we didn't have a lot, but we didn't need a lot.
Uh-huh.
So the finances were never really a big issue. But I would work to buy my own car. I did pay for my own education and take loans out and things like that. But it was also easier back then to go to local universities and things like that. It wasn't an arm and a
Right.
leg for those loans.
Right. Right.
Financially, things were probably one of the better things going on in my family.
So take us through your first depressive episode. How old were you when that happened?
Well, it was 1980. I was 19 years old. And this is a time where, there's no cell phones. There weren't really even answering machines. So if you weren't there to pick up a ringing phone, you weren't there to connect with
Yeah.
somebody.
Right.
And I had always kind of struggled with my dysthymia at that time. And I knew I couldn't go away to school. I just didn't have the capacity to do that. So I went to a local community college and I commuted and I worked. And I did really super well in community college. For whatever reason, I think I had a little more agency and I was able to do a little more than in earlier times in my life. So I was able to succeed academically in ways that previously I didn't. And, but it was hard making friends because it was a commuter school. So I started to do well, graduated from that community college and got a scholarship to a local university at Hofstra University.
Good for
And when
you.
I transferred there, it was a very different experience from community to a somewhat well-credentialed, locally prestigious university. And I struggled socially. I felt like I didn't fit in. It was hard for me to meet people. And I started to descend slowly into a depressive episode. It started with not wanting to get out of the car when I got to school. Then it was, I don't really want to get up to go to school. And then eventually it was, I don't want to get out of bed to go to school.
Yeah.
And my mother was working, my father was working, my sisters were doing their thing, and it was easy for me to get lost, become invisible, because I would go to school after everybody left. And I would come home before everybody came home from work. So it was easy for them to not know that I wasn't going. And very bad, corrosive, negative thinking, not wanting to be alive anymore. Nothing's good. Which was really alarming because I had never really had terrible thoughts like that. And before I knew it, I was not attending school at all. And I didn't tell anybody. And my thoughts got worse and worse. And there were guns in the house. And I had learned how to use all these guns. And I made a plan and decided to act on the plan one morning. This is what I'm going to do. And thinking, well, this will be good because then I won't feel this terrible ache and pain and sadness and despair and all things. But I luckily didn't do it. There was something about opening the door where the guns were. The doorknob was so cold, Dr. David, that it shocked me. It did something. It made me, for a moment, have some lucid thinking, like, what are you doing? What are you doing? Your sister's going to come home and find you. What are you doing?
Yeah.
And it stopped me, luckily. And so I called my mother. I said, you got to get home here. I'm in a really bad way and I need help. And the next day I got to a psychologist who told me I was in a very bad depressive state. And he saved my life and changed my life. And it's hard for me to believe I ever felt or thought those things once you recover from that very depressive episode. The frontal lobe of the brain really functions better when we're
Yeah.
not depressed. And it's terrible when we are, because we think
Yeah.
this is a good solution. Makes sense. Yeah, let's do this.
Yeah. Yeah. So there was that risk of suicide.
Mm.
So what did the psychologist do for you? Did he give you a diagnosis? Did he hospitalize you? What
I
happened?
I didn't get hospitalized, which interestingly probably would occur now. It didn't happen then. What did happen was I went back the next day, and I went back the next day, and I had about 5 sessions that first week to stabilize. And I learned about what this was, that I had had a dysthymia all my life. And that because of these other situations going on, I kind of moved into this double depression, into a depressive episode.
Tell us about the dysthymia, because everyone may not be familiar with that term.
Well, dysthymia used to be what we would call, according to the DSM, it's a chronic form of depression that doesn't ever get as bad as depressive episodes can. But for the most part, it's so chronic that sometimes you don't even realize that you're struggling with this I call it a low grade depression,
Yeah.
where you're not content, but you're not despaired. Your thinking isn't really clear, but it's not impaired. And I would sometimes describe it as being like Eeyore, the donkey from Winnie the Pooh, that, oh, gee, yeah, everything's bad. And there's this blah malaise that you live with
Mhm.
day in and day out. And what happens for some children and adults is you don't even know that you really are struggling with an illness, because you become so complacent with it. And I
Yeah.
just thought everybody was tired and thought sad things. And some of the risk when you have an undiagnosed depression like dysthymia, or what's now called persistent depressive disorder, is if it's untreated and you have other triggers or life stressors that stack on top, it can push you into a more significant level of a depressive episode. And having both is called having a double depression. It's doubly hard.
Yeah.
But there are many ways to get better. Diagnosis is key. So I was diagnosed and really began to respond to talk therapy. That's what I was doing at 19 years old back in the 90s, back in
Yeah.
1980.
Yeah. Yeah. Let's talk about that, about talk therapy. How did you experience it as a 19-year-old? I mean, you had somebody listening to you and caring.
It was amazing, because my family was a very loving family, very affectionate, loving. We were there for each other and fierce to protect each other, but we never really talked about anything. So I was so fragile at that first appointment that I think I would have done just about anything. And I was very grateful to find a therapist that was sensitive and gentle and warm and just there for me. And it was truly an amazing experience to feel important and listened to, because I had never had that before, and seen. That's what I would say really was life-changing for me, is that when I walked in that room, that therapist was there to know me and learn who I was and help me understand why I was going through things, what strengths I had, what I could do with those strengths to help my weaknesses. It was such a wonderfully healthful experience that I had to become a psychologist, because it changed my life so dramatically.
Yeah. Now, was this therapist male or female?
Was a male therapist. Um, and he was affiliated locally with Adelphi University in a postdoctoral psychoanalysis
Uh-huh.
training. I did not know at the time at 19 what any of that meant.
No.
I didn't. I just thought a therapist was a therapist, but there are many different kinds of therapists and many different kinds of training. And this just so happened to suit me and my needs. And I remained in therapy for over almost 15 years with this man.
15 years.
Mm-hmm.
Yeah, wow. I
Mm-hmm.
assume the frequency changed.
Yes, I used to go 3 times a week. And as I got better, I would go once a week. And he was there as I, finished college and the schools I went to become a psychologist. As I got married, just a significant person in my life that held appropriate boundaries, was always thoughtful and mindful. I learned so much from him as a clinician, and
Yeah,
also really healed because of the type of clinician he was.
yeah.
And I still, from time to time, we cross paths, and I talk to him, and I say to him, and he says, "Yes, I know." Yeah.
Yeah, yeah, that's sweet. And were there any pharmaceutical treatment at that time during that period?
No, which was interesting. I look back, and Prozac was just being born, so to speak.
Uh-huh.
And I suppose I responded well with the frequency of treatment, that there wasn't a recommendation for some tricyclic antidepressants or something more involved. But no medication. So my first depressive episode, I recovered from and went into remission from, and remained in therapy longer than maybe I mean, I certainly didn't need to stop. I wanted to continue because there was a journey to psychoanalysis that I really enjoyed. But I prepared when I had my daughter to be ready for a postpartum onset. And I'm glad I knew about that, because I did. I had a terrible postpartum onset within hours of delivering her. And about 2.5 to 3 weeks later, I reached out and I found a psychiatrist, and I said, I'm ready to try Prozac, because it was almost the middle 90s. So it had been out for a while. Unique experience, because not only did I feel better over the course of 6 to 8 weeks, I felt better than ever. I realized that there was a level of depression that really got eased with the use of the antidepressant for me.
Yeah,
So it was a very powerful experience to see talk therapy and pharmaceutical therapy and the differences that both offer. And I've remained on it because I have tried to come off of it, and my depressive symptoms come back. So it could be a little frustrating to see, like, oh gosh, the dysthymia is still there. It's
yeah,
like a shadow, but just like I wear glasses or I take my high blood pressure medicine, I take my antidepressant.
yeah. So there's and yet despite all of this, there's so much success in your life in terms of your educational experience in graduate school, it sounds like,
Mm.
and getting into these programs, doing well in them, uh, getting married,
Mm.
having one child, more
One
children,
child. Yeah,
one
one.
child. Yeah. So all of that's very positive, and but there were other episodes that have come subsequently, right?
Yes, I found that, with each major life change or trigger, when my father passed, which was about 10 years or so ago, I said, oh, because he had been ill for a while. And I said, I got to get ready for this. And it still packed a punch. It was still so hard, in spite of the fact that I was prepared. And I reached out to my prescribing practitioner and said, maybe we'll just think about doubling or getting things ready in case I need it. And it was great to have all that forethought, because I did need, additional doses just to kind of get through those times. But it's also helpful for us as clinicians to know that when we work with patients, that there are some people whose life stressors really press heavily on their physiology and their emotional experiences, while sometimes others can float a little better.
Yeah.
But I wasn't able to do that. So I know, I have some current issues going on now with my in-laws' health and my mother's health. And, I'm ready. I'm as ready as I can be to see those early symptoms so they don't kind of root themselves in a way that it takes me by surprise. Because that's the tricky thing. Depression's sneaky.
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 Yeah. Say a bit more about that. That sounds like a really important thought.
The one thing that I will say, living with depression and working with patients who have depression, is that I'm never surprised by a story that says, and then out of nowhere, I started to, really feel depressed. And the person catches themselves saying, well, it's not really out of nowhere, because I know it's from A, B, C, or D, but man, I didn't think it would get me so fast.
Yeah.
And I would see that too. I thought with the birth of my daughter that the onset of a postpartum depression, I didn't think it would be that fast. It was hours, and I had a great pregnancy. I was feeling so good. I felt really nice. I was ready, wanted to be parents, the whole thing. And depression doesn't care if you're rich or poor. It doesn't care if, you're healthy or not healthy. It just wants to get in there and deform and disorganize and really try and make you think the world is a terrible place that you don't need to live in anymore.
Sounds like you sort of personify depression as if it's an evil spirit, an evil force, something like that.
Listen, I'm sure you experience this too with certain patients in recovery, how they'll say, how did I ever think those thoughts? Or, I'll work with kids who say, I know you had to put me in the hospital and I was mad at you, but I'm glad you did, because I don't even remember thinking those thoughts. How did they ever happen?
Yeah.
So it's so important, with shows like yours and books and even movies or news media that really helps us understand that this isn't something that happens from a weakness of character, or you're just tired and lazy, or you can't snap out of it. There's a real physiological illness that occurs. And some of your life narrative and the ways that you've learned to cope can make it easier for you to deal with depression. And in my case, did not. I mean, there was no way I would have been able to survive my childhood and my illness without having help.
Yeah. So talk to us a bit about the types of depression. There's depression and there's bipolar and maybe others. Tell us about that.
I remember when I first went to a psychiatrist who was recommended through the postdoctoral training center that I was getting my certificate in. And I was a little nervous to go because I felt, embarrassed, like, gosh, I'm doing this, and really, can I practice? Can I do this? And he had said to me that, there are so many people that struggle with different kinds of illnesses, and that as long as you can function well and you're consistent with your treatment, he saw no reason that I couldn't be successful in doing what I wanted to do.
Yeah.
And he was the first person to really help me understand, with depression, there are two poles, two extremes. Unipolar, meaning your depression kind of lingers in this very low ebb, sad, despairing, dark place. And another extreme, which is the other end, which is the bipolar end, where you have very expansive, almost high octane, elevated states of happiness, joy, maybe even what the Greeks called mania, which is where we get the name from. And for a while, when I came in with my unipolar experience, I remember him sitting on the edge of his seat, and I would say to him, Dr. Larry, it looks like you're waiting for something. And he would say, yeah, I'm waiting for the other polarity to show, because generally we see that. And I had explained to him that, I did notice things in my father and my grandfather. So we were primed to see maybe an elevation, or for my depressive episode to move into another level, but it never did. So I have a unipolar depression, which is called persistent depressive disorder. And the unipolar depressive disorders are major depressive disorder, persistent depressive disorder, and a whole other, there are many others that fall under that category. But when we talk about bipolar, this is where you not only experience depression, but you also experience things that are elevated. And you can have bipolar 1, which is what the general public tends to see in movies, in books. This is the very highs and lows, people spending, lots and lots of money, or falling into days or weeks where they're sleeping. And then there's something called bipolar 2, which is a bipolar experience, but it's less intense and it's a little more slippery to diagnose, because you don't have mania, you have hypomania. And then there's another one called
and hypomania is what, a sort of less extreme
correct
experience of elation.
Correct. So whereas somebody with mania might be spending thousands and thousands of dollars, somebody with hypomania might be, as another example, just buying, 25 cans of coffee because they're on sale. It's not as extreme and noticeable. The sleepiness or the downtime of depression may not seem as intense. So we call it like a low grade bipolar, and it is hard to detect.
Yeah.
And then there's something even lighter than that, which is called cyclothymia. And that's just kind of like a moody and elevated, and then comes down to irritability and sadness, back up to a little elevated state, which is even trickier. So, as much as it's important, if you have a foot issue, you don't go to a hand doctor. When you have a mental health issue and you think it's a mood disorder, you kind of want to try and get somebody who knows what's going on and is trained in mood disorders.
Yeah. Good advice there. What about suicidality? You mentioned that that today you probably would have been sent for hospitalization for even a short period. I assume that's because you would have reported suicidal feelings, and that would have made that happen.
Yeah. I mean, I had a plan, and actually, I memorized, but mine was very extreme because it was interrupted. I not only had a thought, the plan was in action, and it was interrupted. The next one after an interrupted is a completed suicide. So I was very, very high risk. And we know so much more now about the intent of suicide, how to take notice, how to look for certain signs. It is a preventable death. I should also say at the time when I was struggling, I had lost a friend to suicide, so that was there. But yeah, I certainly would have been in the hospital. And nowadays, the experience there can be one where it's not like the movies or One Flew Over the Cuckoo's Nest. It's particularly if you can call ahead and get a bed and let the team know that your patient's coming in. There are really wonderful ways to help make sure a person's safe while they're getting the help they need.
Yeah, yeah, yeah. Is there a hope for a cure out there, or not?
Mm. Well, as somebody who's a lifer with my antidepressants, I feel as close to as good as possible. A cure, I don't know. I think as much as critics will say, especially with the soft science of psychology that we do, even though there's evidence of brain structures that are different with depression, neurochemistry that's different, certain electrical activity that's different, we don't really understand the origins specific to each person because I think they're so variable.
Yeah,
And as such, I think it does become a difficult thing to talk about cure. I like to talk about quality of life and living well with an illness, because I consider
right.
myself living as well as I can with my illness.
Yes. Yeah.
I have side effects from the meds I take, but I live with them. I have weight gain. I have night sweats. But okay, so I go to sleep with a sheet over my pajamas, and I'm married and have my kids. My biological directives are done. I'm not
Yeah.
too worried about that. I don't have to
Yeah.
secure a mate these days, and I do the best I can. But there's always more research looking to understand, because there are many people different than myself, because I consider myself someone who has found remission and recovery with my medication. But there are others who have treatment-resistant depression, and that's more the norm than not. About 60% of children and adults will not find relief with traditional methods. So
Wow.
research keeps going forward, and that's a good thing, because there are many people who don't feel well.
Yeah. 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 I like what you say about living well with depression. And one thing that's clear is that you've learned some cognitive strategies,
Mm,
mainly of self-acceptance,
yes.
to
And
instead of running yourself down, you say, okay, this is like I have a physical disease, and
mhm.
you know.
Yeah, I wouldn't shame somebody who has cancer. Why should I shame myself for having depression? I don't catastrophize. I try to use certain types of cognitive reframing to be positive and say, okay, I limit what I watch on television or I read on the news. It can trigger me.
Sure.
Um, there are certain things that I will deliberately not do. I don't drink. I don't use any recreational drugs. I just don't want to tip the scale in any bad way.
Right.
And sometimes I say no more than maybe my loved ones wish I would, but I know what I can and can't do. And
Yeah.
what I'm
Yeah.
willing to risk it's too fragile. So,
Yeah. Yeah. Well, that's great that you have that self-knowledge.
and it only happens because of therapy, and it happens
Yeah.
because of psychoeducation and all those things, because other listeners can find that too. They
Yeah.
can find that.
one of the great resources that's in your book is you have an appendix of people with various varieties of depression that they've lived with, who are famous, accomplished, well-known, and actors and actresses and authors. And are there some that come to mind that you can just rattle off?
Sure. Well, President Abraham Lincoln would often talk about his melancholy and depression, and that it provided him with an empathy that enabled him to really understand what was going on in our history and make it so that everyone could live a life of quality. And there are many people who think that without that, he might not have been the type of president and the man who wrote the Emancipation Proclamation and really helped end slavery. There are, and this is not something that I borrow from Dr. Kay Redfield Jamison. She wrote a great book, Touched by Fire, which talks about all the brilliant poets, artists that struggle with bipolar disorder. So I borrowed this from her. She started this decades ago.
Yeah.
But I wanted to focus on, someone like Serena Williams, who's one of the greatest tennis players, and she struggled with depression. And she talks openly about it, and she's a champion. So it gives us hope to be able to say, well, if she can kind of move through things, that gives me inspiration.
Yeah.
All kinds of artists. I mean, I'm a big Bruce Springsteen fan, and his music, when he talks about sadness and depression, has this depth and texture that, has made him appreciate his life, but also understand struggle.
Yeah.
So there are politicians and so many people who, when they talk openly about their struggle with depression, they say it's okay. They help destigmatize it. They help make the ordinary person say, well, if they can get through it, maybe I can. So that's why I wanted to have that and include all kinds of characters and high profile people, a lot of sports people, and that leaders who lead countries, who sometimes, if you're emotional, you can't lead a country. Winston Churchill did a pretty good job.
Yeah. Well, this has been delightful. As we wind down a bit, I wonder if I can ask you, what are the takeaways that you want people to leave with this conversation?
That there's no shame living with a mental illness, that if you're struggling with one, try not to compare yours to somebody else's. And you want to find someone who understands your particular issues, validates you, and helps you to find recovery, because there is hope out there.
Well, that is a great message to leave us with. Dr. Deborah Serani, I want to thank you for being my guest today on Shrink Rap Radio.